Hello guys, how are we all doing? All right, we are back again. It's another topic. Yes, we are going to discuss about coding of medication on your implementation station. Everything you need to know about coding from code 1 to code 10. All right, still remember to give me a thumb up, subscribe to my channel. Still remember to like, comment, and share. I love you guys. I wish you all the best in your examination. You are going to be successful. Please make sure you are practicing and practicing and practicing. All right, practicing is the best key to success on your OSCE examination. You make use of your marking criteria. If you need any help, comment on the comment section. I need help. So I'm going to reply you and then we get started. All right, stay tuned. If this is what you like, let's dive into what we have today. So guys, let's see what our implementation booklet is talking about coding. Okay, under page 1, the place you are going to see once only medication, that is where it is. Now it says that if a dose is omitted for a reason, the nurse should enter the relevant code on the administration record and sign and date the entry. All right, you can see that if a dose is omitted for any reason, the nurse should enter the relevant code on the administration record and sign and date the entry. Yes. Now, for you to make use of code 1, it says medicine unavailable. Inform doctor or pharmacist. Now, you want to go and do Mrs. Jones medication, and you notice that medication, one of the Mrs. Jones medication, let me say paracetamol, is no more available. All right, so what you need to do is to go to your charts, okay, under that medication that is not available. You code it CODE 1, that is code 1. Then you put your date and put your signature. All right, that is what this thing is doing. And then you can now inform the doctor and also the pharmacist that this particular medicine is not available. Okay, that you want to do a medication, you notice that paracetamol is no more available. What are you going to do? You are going to code it code 1 and then inform the doctor and the pharmacist that this medication is no more available. That is it. All right, so under code 2, they said that patient off word. So when are you going to use this code 2 under your examination when you are doing your exam? Now you notice that you went a Mrs. Jones ward, enter inside her room, and you notice that Miss Jones is not there, and you asked, they said that she went to go and take her shower in the bathroom. You are going to code it, because that particular medication, you are meant to give that medication by 12:00 hour, and you enter her room by 12:00 hour and she's not there. Maybe she stepped out to do something. Okay, so you are going to code it. Yes, you code it code 2, patient off ward. You go to under where that medication chart is, where they said today. You write CODE, that is code. Then you write 2. Okay, you put your signature and date of your examination. All right, then this is code 3. When are we going to use this code 3? When we are going to use this code 3 is when our patient is self-medicated. Yes, the patient has full capacity. There's no impairment, nothing like dementia. It's not forgotten anything. It has full capacity, nothing like impairment. Then this patient is under self-medication. That is when you are going to use this code 3. That you are doing medication, you came to her own and you see that she is self-medicated. You code it CODE 3. Then you put your date and sign. Okay, And then when are we going to use code 4? Now, you can see the code 4. See what they said there. I want it to be very clear. Here, unable to administer. Inform doctor. Alternative route required. Let me say that you went to administer Mrs. Jones medication. For example, you went to give Mrs. Jones her medication. On getting there, she was vomiting. She is feeling nauseated. Are you going to still give that medication? No, you cannot give it to her, because if you give it to her, she's going to throw it up. She's going to vomit it. You are not able to administer that medication. All right? So you are going to inform the doctor that you are not able to administer this medication, so that the doctor can now prescribe alternate routes. That is what this place is saying. Okay? That you are not able to administer this medication, or this patient cannot be able to swallow. You are doing medication. The patient cannot be able to swallow. The swallowing difference is not there. Are you going to give that patient that medication? No, you will not give that patient that medication, because the patient will aspirate and choke while taking that tablet. What are you going to do? You are going to inform the doctor the situation of things, so the doctor can be able to prescribe alternate routes. That is what this place is saying. And that is when you are going to make use of this code 4. All right? So now, we move over to this one, which is code 5. Start dose giving. Yes. For example now, under this once only medication, you see this once only medication now. We are having medication today. Drug is ondansetron. Dose is 4 mg. Route is per-oral. Reason for giving is nausea. That's the instruction. Time required is 12:00 hour. The signature of the prescriber and BIP number is here. And then you dispense this medication and you give it to patients by the same time it was prescribed, 12:00 hour, and you sign. Okay? Then on getting to regular medication again, you see that this patient is still having this ondansetron under regular medication. Are you going to administer that medication, guys? Answer me on the comment section. Are you going to administer this ondansetron? No, you will not administer it, because you have already dispensed it under once only medication. You have given it under once only medication. Okay? So under that regular medication, what you are going to do is to code it. Start dose giving. You are going to code it code 5, which means start dose giving. Okay? That is when you are going to make use of this. Once only medication is given, which is start dose of medication has been given, and then you go to regular medication and you still see that same medication, and it's due again on your time. Okay? You can't give it again. Let me say that this medication that was given by 12:00 hour, you went to the once only medication. You are doing medication that is under 12 under let me say 1:00 hour, which is 1 o'clock, while it was already been given by 12:00 hour. Are you going to still give this medication again? You can't give it again. You have to code it, the start dose given, which is code 5. You put code 5 under there, write your signature and the date of your examination. That is what they are trying to tell you when to use this start dose giving. Okay? Then next one we have here is code 6. Here, prescription is incorrect or unclear. Let me give you example. So guys, for example now, let's use this medication, lansoprazole. Start date is today. Sorry, lansoprazole. Date is today. Dose is 30 milligram. Frequency is once daily. Route is per-oral. Duration is 4 weeks. Time is 12:00 hour. Okay? And then now, start date is today. So indication is gastric reflux. Alright? Now, you now move over to prescriber signature and BIP number. You didn't see any prescriber signature and BIP number, guys. There is no prescriber signature and BIP number. What are you going to do? Are you going to give this medication? No, because the medication is incomplete. Medication prescription for this lansoprazole are incomplete because there is no prescriber signature and BIP number. So what are you going to do? Now, so this is where this one comes in. Prescription incorrect and then unclear because it's not complete, it's incorrect. All right, that is when you are going to code it, code 6. Okay, then where are you going to write it? Here, this is the time of the medication that is being prescribed. Here, this is the time, 12:00 hour. So guys, you now move over where they said today under your medication charts, which you are doing medication that is due on 12:00 hour. All right, we are talking about this lansoprazole that is having there is no prescriber signature and BIP number, which is supposed to be here. Okay, so you are going here to code it. Prescription is incorrect. Code 6 boldly. Now you write your date, the day of your examination. Let me say 2/1/25. Then you sign with your signature. That is it, guys. See it. You have coded it. Code 6. All right. That is when you are going to use this code. And then let's proceed. Code 7. This is code 7. Here, this is code 7. Patient refused. Patient refused. Okay, you wanted to give the patient medication after explaining the indication and the side effects of the medication to the patient, and the patient told you, "Nurse, I'm sorry, I don't think I can take this medication." You don't have to force the patient. No, you don't force her. It's her right. She has the right to refuse the medication. Yes. You told her, okay, no problem, all right? Whenever you are ready to take the medication, let me know. Then go and code it. Go to the place where they say today. Write CODE 7. Put your date and then your signature. Okay? That is when you are going to use this code 7. You don't force patients whenever it told you, no, I don't want. All right, but the only thing you have to do is to make sure you explain the indication and side effects of the medication. That is it. You don't force them. All right, and then code 8. They said kneel by mouth on doctor's instruction only. Yes, when doctor told you that this patient is going to be on knee per oral, maybe this patient is taking paracetamol, or this patient is taking lansoprazole, and the doctor told you that this patient is on new per oral. Are you going to give that medication? No, you don't give it. What you are going to do is to code it. Code 8. Put your day of examination, the date, and sign. That is when to use this kneel by mouth. All right, maybe that this patient has been vomiting, is having nausea and vomiting. You can't give the patient that is having nausea and vomiting medication orally because she will throw it up. It will also irritate the patient. She is going to vomit more. So you can't give it. You code it on doctor's instruction. All right? Now, when are we going to use code 9? Here. Pulse low and or low blood pressure. When there is low pulse and or low blood pressure. This is the one of the reason, very important. Guys, this is fail if you didn't do it correctly. When you are administering blood pressure medication, let me see, aminopilin, lisinopril, lisinopril, what else? There are so many of them. Okay, when you are administering any medication that is under blood pressure and pulse regulatory medication, you're supposed to ask assessor, please, what is my patient's blood pressure level and then pulse rates. So guys, for example, you cannot administer the digoxin if your patient's pulse rate is less than 60. You cannot administer it when the patient pulse rate is less than 60 beats per minute. It's a fail if you make that mistake. And this is one of the reasons that is very important that you are going to ask your assessor, please, what is my patient's blood pressure today? Or what is my patient's pulse rate today? Yes, when you are administering antiarrhythmic medication, this is very, very important, guys. And also blood pressure. Medications such as amlodipine, you have to ask the patient, lisinopril, ask the patient the blood pressure and pulse rates. Ask it whenever you are administering any medication that is used to control heart rate and blood pressure. Very important. So you won't make mistake of administering medication that is used for regulation of heart rates when your patient's heart rate is less than 60. And when the patient is having low blood pressure, you go and administer blood pressure medication. Is a fail. Okay? Note it that you must ask patient blood pressure and pulse rate before administering any blood pressure medication and the pulse rate medication. Moving over to the next one. They said others state in the nursing notes, including the action taken. Yes, this particular one is used. You are going to code 10 when all this code 1, code 2, code 3, code 4, code 5, code 6, code 7, code 8, code 9 is not inside this book. The reason why you are going to use this thing is that all is not among all this reason. All this reason is not among it. And then there is any other reason that made you not give that medication, then you will code it code 10. For example, allergy. Yes, since we have been talking since, did you see anywhere where they mention allergy here? That is why you are going to put allergy. If your patient is allergic to medication, a particular medication, let me say penicillin, you are going to code it. You code it under, penicillin is under antimicrobial. Under antimicrobial now, you go to where they say today, you code CODE 10, code 10. Put your exam dates and sign. Once you sign, okay, you did not administer it. Remember that you are not signing this book when you are dispensing this medication, guys. You are not coding this thing when you are dispensing this medication. It's after you must have administered that medication and patient has taken it. And then you are going to go back and code and sign the medication that was given, the ones that you did not give. Now, this particular page is very important. Here, omitted dose of medicine could turn others and delayed doses. Here, this last page is very important. What are you going to do here? Let me say that lansoprazole that we did not administer because the patient is what again? There's no prescriber signature and BIP number. How are you going to chart it here? So you go to omitted medication after you must have administered all your medication. Your charts under your date, you put the date of your examination. Okay, put the date of your examination. When you put your dates, the name of the drugs that you omitted. That is lansoprazole. Okay, now you have written lansoprazole. Now, dosage of this medication that you do not administer is 30 milligram. All right, and the route is oral. Okay, and the instruction is for gastric reflux. Here, time of giving, not giving. Yes, not giving because you didn't give that medication. Okay, reason for omission. Reason for omission. Here, what you are going to do here is write code 6. Medication is incorrect or unclear. That's the reason why we didn't give it, because there is no prescriber signature and BIP number. That is why. And then you sign your signature. You signed. That is it. That is how it's being done. All right. Then, if the reason why you did not give this medication is because your patient is allergic to penicillin, okay, what you are going to do now, see what they said here. Reason for omission 10/delay that is more than 2 hours. Okay, now we didn't give that medication because our patient is allergic to it. You're going to come here and write your date, put penicillin, write the dosage. Okay, then you write the route, oral. You write the reason for infection, time of giving, not giving, reason for omission. This is the only time you are going to write sentences here. You write patient is allergic to penicillin. Patient allergic to penicillin. Or penicillin allergy. You put it here boldly. That is the only time you are going to write here. Apart from patients, if the reason do not fall under this 10, you can just code it once there is a variable code for it. But if that reason fall under this 10, you are going to write it in a sentences under here and then put your signature. That is it, guys. That is it. You can see that this coding is simple, very simple. Okay, that is it. And then you still remember to go and sign your signature under the space that is provided for the person administering this medication, which is on the first page of your medication. Okay, so that is it, guys. So if you get value on this explanation, still remember to subscribe, comment, like, and share, guys. Thank you.
So guys, I think I have actually done justice to the explanation of this coding. All right, just remember to code very well. If you did not code very well on your examination, is a fail. I keep telling you that OSCE is simple, OSCE is doable, OSCE is simple. Yeah, it's simple. Okay, and I know that nurses are brilliant, nurses are smart, and nurses are intelligent. All right, I wish you the best of luck in your examination. All the best. Congratulations to all the beautiful nurses that have passed their examination. Thank you for watching this channel. Still remember to give me a thumb up, subscribe, comment, and share. Okay, see you guys in the next video. Bye.